In this video, a nurse will understand the various aspects of the bandaging technique, steps of procedure, article required, aftercare, and most importantly, what to do when things go wrong. In other words, the common clinical errors. It is a strip of material which is used to immobilize and support the injured part of the body. Bandaging is a process in order to protect or cover the wound. So next we are going to discuss about the purposes of the bandaging. There are various purposes of bandaging such as to protect the wound from contamination, to apply the pressure, to protect the wound from the hemorrhage and to protect the wound from the infection. So next we are going to discuss about the various types of bandaging. The types of bandaging are as follows, that is circular bandage, spiral, reverse spiral, spica, figure of 8, jaw, Kaplan, abdominal binder. Arm sling. Arm sling hold the forearm in raised and horizontal position and support the upper arm, forearm and wrist. So in this we are going to show you the demonstration of the arm sling. Equipments required: a tray containing loose gloves, appropriate bandages, scissor, adhesive tape, dressing material like gauze, kidney tray. Introduce yourself to patient.
Good morning, sir. This is Shilpa, your science staff from 8 a.m. to 2 p.m. Sir, may I know your name?
Karthik.
Okay, Mr. Karthik.
Check doctor's order sheet. Explain the procedure to patient.
Sir, as you have pain in your hand, now I am going to apply a sling.
Perform hand rub. Wear loose gloves. Select the bandage of proper size and material. Position the patient. Ask the casualty to support their arm with their other hand. Gently slide the triangular bandage underneath the arm. The point of triangle should be underneath the elbow at the injured arm. Bring the top end of the bandage around the back of the neck. Fold the lower end of the bandage up over the forearm to meet the top of the bandage at the shoulder of the injured side. Tie the two ends of the bandage together in a reef knot above their collarbone and tuck in the free end. Adjust the sling so that it supports their arm all the way to the end of their little finger. Make sure that the edge of the bandage by the elbow is secured by twisting the fabric and tugging it in or using a safety pin to fasten. Check the circulation in their fingertips every 10 minutes. Press their nails for 5 seconds until it turns pale. Then release to see if the color returns within 2 seconds. Aftercare. Discard the waste according to biomedical waste management policy. Perform hand hygiene. And document the procedure in nurse's notes. Key points to remember. Always check for the correct size and type of bandaging according to the location of wound. Bandaging should not be too tight so it can interfere with the blood circulation.